Okay. I really appreciate that you have me today. Thank you very much. I'm very
Sure,
happy.
no problem.
I am Nagi Ishihara from Hope Innovation Lab, and I am a promoter, and also I do general affairs in Hope Innovation Lab. And I read a book translated into Japanese, and I think the English title is The Oxygen Advantage. Is it?
Yes,
Yes,
that's correct.
and thank you. I was so moved that because I believe that doing deep breath is good for our health. So I was surprised about that.
So, but with the oxygen advantage, it tells you don't take deep breaths. And, you know, I think it is how people interpret.
Yes.
With breathing, we have to consider it from 3 different dimensions. From a biochemical, biomechanical, and also in terms of the speed of the breath. And very many people get confused when they hear a deep breath. What is a deep breath?
What is the deep breath?
When people think of, in Japan, if people are told to take a deep breath, how do they respond? Do they take a big breath? Or do they take a very soft breath with lateral expansion and contraction of the lower ribs? A deep breath is like this. All that's moving is my lower ribs. So deep means far from the top. So deep. So I suppose that's the difference, huh?
I didn't see
much movement. So if you have your hands either side of your lower ribs, and when you breathe in, the lower ribs should gently move out. And when you breathe out, the lower ribs should gently move in. That would be a deep breath. Not so much from the chest. And then when we breathe less air, we gently slow down our breathing to create air hunger. And this helps the blood vessels to open up. It also brings the mind into a state of relaxation.
Okay. I think I understand more.
Okay.
Okay. I think I told you that we are going to do live on Twitter, but it was my mistake, and I will just record this and I will upload this on YouTube later.
Okay, that's good.
So not live.
Fine. No problem.
Thank you. And today I would like to ask you about yourself, about your job, and about importance of breathing, and about the Oxygen Advantage program, and so on. So I'm so excited to interview you. Sure. But I'm nervous a little.
No, you're fine. Don't worry. I have a very nice job teaching breathing. It's really wonderful. And this has been my area of work for 20 years. And, you know, working with young children right up to older people, to people in the military, people in the police forces, people in the corporate world. So many different breathing techniques for different people. Some breathing techniques to help with sleep. Some breathing techniques to help with focus and concentration. Some breathing techniques to help calm the mind. Some for asthma. Some to open up the nose. Some to increase blood flow. And it has been very, very nice because breathing is very powerful. But many people don't understand or don't know that just how powerful breathing can be.
I didn't
It
know
has
that.
an enormous potential. And I think the book, The Oxygen Advantage, does quite well in Japan, which is really nice. This is great. I do a training in Japan next month.
Oh, next month.
But it's done virtually. I don't fly over. I was due to fly over, but it's going to be virtual. It's on the 30th and the 31st of May. But I was there 2 years ago before COVID, and it's been really nice going to Japan. Very nice.
Which part of Japan have you come?
Into Tokyo and in the other cities. I can't remember. It was a smaller city because I traveled quite a lot.
Okay.
And I can't remember the second city, but I gave a training in Tokyo. And then I went to a dental practice in a smaller city that was, I think it was about two hours drive by train. So it was quite a bit away. And we worked with many dentists mainly.
Dentist, I see. So,
because dentists are interested because of the face. So in order to have the mouth closed and the tongue resting in the roof of the mouth, the face grows better. As opposed to if a child has the mouth open, it can affect the growth of the face.
Yes, I was also surprised about that.
Yes, it's new information for many people.
How just a moment, please.
You're okay.
I wanted to ask a question about that, and it was what should parents do for children to make it habit to do nasal breathing?
I think it's very important for parents to observe their child's breathing. And especially if they see that the child has the mouth open when the child is watching television or distracted or doing their homework or even doing physical exercise, and especially during sleep. And there are techniques to help the child open up the nose. So if a child has a stuffy nose, we ask the child to close their lips, breathe in and out through the nose, hold their nose, and gently nod their head up and down to help open up their nose. And then the child can breathe easier through their nose. And we also have them wear a tape called myo tape. And it's a tape that goes around the lips to help bring the lips together. Because we want the child to breathe through their nose all the time. We need to change the behavior. And by wearing the tape, it's elasticated. So if the child forgets to breathe through the nose, and if they breathe through the mouth, as soon as they open the mouth to breathe, the tape brings their lips together, and it tells them that they need to be breathing through the nose. So I think it's really important to change the behavior, as well as, practicing breathing exercises to help improve functional breathing patterns.
So maybe parents should know about breathing first to support their
children. It is very important. Well, if you think of it this way, Naji, that children who are breathing through their mouth during sleep, it can contribute to tiredness. They have difficulty concentrating. Children who are tired have 10 times the risk of learning difficulties. So no child should snore. A child shouldn't be snoring. The child shouldn't be stopping breathing during sleep. And if the child is snoring or stopping breathing, it will affect their cognitive development, and it can affect their cognitive development. So it's really, really important. I was a mouth breather when I was a child. And for me to get my grades, it took a lot of work. Because if you have your mouth open during sleep, you are not waking up feeling refreshed. as an adult or as a child. And for forward development of the face, we need the mouth closed and the tongue resting on the roof of the mouth. And that is very important.
I heard that your experience lead you to study about breathing more and telling people.
Yes, it was only my experience that that guided me to find a technique. I had stuffy nose, I had asthma, I had poor sleep, and it is not good growing up with poor sleep and asthma. It is, you know, big difficulty in school, not because the child is not intelligent, but because they are tired. So when I came across this information back about 23 years ago, it changed my life, completely changed my life. And I was never going to, I never would have dreamed that I would be teaching breathing, but that's the way things happen. Yes.
So 23 years ago, no one knew about the breathing fact.
Not many people would have known about breathing, functional breathing. It was not something that was being discussed. Yoga breathing, of course, but this is not about yoga breathing. This is about the application of functional breathing patterns, everyday breathing. And everyday breathing is breathing in and out through the nose. You know, if you think about it, what does the mouth do for breathing? And the answer is it does nothing. The mouth, it doesn't warm the air. It doesn't moisten the air coming in. It doesn't regulate volume. You don't harness nasal nitric oxide by breathing through the mouth. Mouth breathing is upper chest breathing and fast breathing. And mouth breathing is contribute to agitation of the mind. So it is not ideal.
I read mouth is only to eat.
Yes. Eat and to speak
Yeah.
and to drink.
Drink.
Yes.
How did you, was it difficult to study because there are not much people know about the breathing? How did you study?
I went to Russia to study. So there was a doctor called Konstantin Buteyko, and I went over to his clinic in 2002, and I learned the exercises there, and then I returned back to Ireland to teach them in Ireland. And then in 2005, I started traveling to teach the exercises. So most of the work, of course, was always in Ireland, but then I started traveling as well. So that was good.
How many countries have you been to study? Teach?
A lot. I don't know. Many countries. To give you an example, in 2019, I traveled around the world teaching. I started off in Ireland, to Europe, to the United States, to Australia, to Singapore, to Vietnam, to, I think it was Dubai, and then all the way back again. But many countries, because now breathing, like even I've been to Japan, you know, which is quite a distance from Ireland.
Yes.
And teaching breathing exercises to people in Japan. So many countries, yes.
When was the first time you came to Japan?
My first time, I think I've been to Japan twice. I've definitely been there once, and it was in 2019. And I gave a 2-day training, but I also gave a 4-day training. So I was there for maybe 10 days in total. And I gave a 2-day training to 100 doctors and dentists.
Mm-hmm.
And then for 4 days, I went to a dental practice, actually 2 dental practices, and I gave them 4 days training each. So I was probably there for about 12 days.
Mm-hmm.
But that was in 2019.
Mm-hmm. Is that Japanese Dentist Association something offered you to come Japan to teach dentists?
No, they were private dentists.
Okay.
So dentists with a private practice, but dentists who understand about the airway.
Mm-hmm.
And these dentists understand that when a child comes to them,
Mm-hmm.
we need to not only straighten the teeth,
Mm-hmm.
but we also need to change the habits which are causing crooked teeth in the first place.
Mm-hmm.
So say, for example, a 12-year-old child comes in to a dental practice.
Mm-hmm.
And the 12-year-old child has overcrowding of teeth, crooked teeth. If the orthodontist just straightens the teeth, but does nothing about mouth breathing and tongue posture, when the child is maybe 20 years of age, the teeth go back crooked again. So it's important that if you straighten the teeth, that you also teach breathe through the nose with the tongue resting in the roof of the mouth.
Also, dentists need to give things like this, and also need to teach how to breathe properly to children.
I think it is very important. I think the dentist has a very important role. And the reason being is because sleep disorders affect everybody, or they can affect anybody, sleep disorders. But a dentist can identify the risk factors. So the dentist is looking into the person's mouth. They can see if the palate is high. They can see if the tongue if the tongue is scalloped. They can see if the jaws are set back. So the dentist can see maybe this person has sleep problems. And then the dentist can say to the patient, I think you need to get your sleep investigated. And this is very important. But only some dentists understand about sleep and airway. Most of them don't. But the dentist is in an ideal position to do something about it and to help many people.
I see. So you told me that you have been to many countries for training.
Yes.
And is the most case is from dentist, or you teach other people?
Yeah, I teach many different disciplines. Yoga instructors we teach, Pilates, strength and conditioning coaches, people in sports, performance we teach, and dentists, of course. Myofunctional therapy. We have quite a few myofunctional therapists have become instructors or teachers in breathing. And myofunctional therapy also in Japan, speech and language pathology, physiotherapy. So there are many different disciplines who become, there are 700 instructors throughout the world who have trained, and about 300 of them have trained more for sports, and about 400 have trained more for health.
I see. Now I remember that the title of the book was Athletes.
The oxygen advantage was more for athletes, yes. But I did put in a chapter for children because maybe a child wants to become an athlete. And
Yes.
how can the child become an athlete if the child has the mouth open?
Mm-hmm.
And also, I have eight books, but only one is published in Japan.
Mm-hmm. Yes. Why did you decided to publish the book in Japan?
Normally what happens is that when you write a book,
Mm-hmm.
a local publisher, in this instance, a publisher in the United States, took on the book.
Mm-hmm.
But your book agent, so my book agent then would be at different book fairs.
Mm-hmm.
And I'm not sure how it happened, but normally then a publisher, maybe from different countries, will contact the book agent saying, can we publish this book?
Oh.
That's how it is. So I don't do anything. Somebody else does it.
Okay. You are also writing new book?
Yes. I wrote a new book called The Breathing Cure. And this came out about 3 months ago. And I am now writing another book called Focus. So it's about holding your attention on something, or concentration, or attention span. Because many people, their minds are wandering, and they are not able to hold their attention. So we use breathing, but we use sleep, but we use breath holding, and different breathing techniques to improve blood flow to the brain, to hold attention on breathing, to improve sleep and energy, to increase the person's ability to hold their attention on one thing for a sustained period of time. It is very important. It is very important for work and for family life.
Also for family life.
Yes, because if the mind is racing, it is not good because it increases anxiety. So by training the brain to be quieter, not only does it improve concentration, but it also reduces anxiety. Because a person with a very overactive mind can be more prone to anxiety.
Maybe I should read the book Focus, because sometimes I can't concentrate on work.
Well, I think everybody at times has difficulty concentrating, but some people have difficulty concentrating all the time. But everybody can improve it.
When is the book all published?
I have to write it first, but it's about 80% written. But always with a book, you write it and then you see changes you need to do. And it may be probably about 5 or 6 months, and then it will be written.
Okay. I'm looking forward for the publish.
Great.
Okay. Can I ask something else?
Yes.
Okay. I learned that you choose your life work to help people who have suffered from the same breathing problems as you did. And in Japan, there are many people who don't know what to do for their life work. And is there any advice for those people to get their life work or find something they should do?
It's a very interesting question. I would think that 80% of people do not like their work. How do you, as a child or teenager or an adult, how do you find work that you would love to do? Well, in some ways, you need to know what do you like to do yourself. What takes your attention? You know, if you were going into a bookstore, which books would you gravitate towards? Do you like talking? You know, do you like teaching? What areas interest you most? But sometimes you feel intuition, a hunch. When I did not know anything about breathing, I was using it for myself, and it really made a big difference to my life. But it was when I was driving from one part of Ireland to another, and Ireland is very narrow. To go from one part to the other back then took 3 hours. I got a feeling that I should be teaching breathing. And it was a very, very strong feeling. It was a hunch, intuition. It was something that I knew without a doubt that this is what I would be doing. And I followed it. And of course, there was some risk involved. But overall, the feeling was correct. Sometimes you have to listen to your intuition. You know, and of course, you might have to take a risk. It has to feel so comfortable that this occupation is what you are going to do. It gives you excitement. It gives you drive. You have passion for it. You love to talk about it. You love to read about it. If you find that the topic that you're working in, if you're so bored that you don't like reading about it, or you don't like learning more about it, you are not in the right occupation. You are in the right occupation when you naturally feel compelled towards knowing more, because it gives you good feeling.
I see. I was thinking about that for like 3 years, because in Japan, many children just go elementary school, junior high school, and most of students will go to college because parents and teachers say that you need to study, you need to go to cram school and get good grades and go college. But we don't really know what they want to do.
Yes.
Even after we graduated college, and that also happened to me. So I didn't know what I can do for 3 years, but then I realized, but I like to work. Somehow I like working, so I then realized that I want to tell people that to working is a great thing, but sometimes we need to concentrate on work and their health program, and also maybe we need to coach ourselves. So now I'm doing this promoter to tell people that tell people by spreading people who work, they enjoy their work. So
you help people find a job they love to do.
I'm trying to do that by introducing people who enjoy work, like you. I think you like to work.
I like to work because the work I do comes easy for me. You know, but if I didn't like my job, I would not like to work. And I think there's so much pressure on people to work so hard, and it's not what life is about either. And I, like everybody else, we put in a lot of hours, but is this life? And surely we need to have some balance. But society does not always drive that balance.
Yes. So it will be happier for us to know what we like to do, and
it is vitally important. So it is most important thing, because when you love your job, your stress levels naturally reduce. When you don't like your job, your stress levels will be higher. When you love your job, you continue to learn and you become good at it. It's very important that we find an occupation that suits our skills, and we are all different. It's not about working for money. Money should not be the driver. If you are good at your job, you get financially rewarded anyway. And we have to be realistic. Not everybody can be a rock star. That you have to be realistic, as well as knowing your strengths and your skill set.
And we need to go to bookstore.
Well, bookstore can help. That's only an example, though.
Yeah. Thank you. May I ask you about your online course?
So
Yep.
we have different online courses to teach people to become instructors. And in Oxygen Advantage, we have an online course which I teach by Zoom. And it is 7 classes, but people return. They come back maybe once every month or once every couple of months to learn more. But yeah, we have one fee, and the one fee covers everything. And then the person can come back as often as they need. So the Oxygen Advantage is for sports, but also for health. And then we also have training to become Buteyko instructor, to teach Buteyko method, which is more for health. So it is a good way, because with COVID, of course, it's problem traveling, and I'm happy with that, because now I don't like to travel. I want to stay at home, because I traveled so much for 15 years, and now with the reset, it has been very good, been very nice. No travel, do my work, and yeah, that's good too.
Okay. You told me you are teaching by Zoom, means not a video, but it is
Live.
Oh, okay.
Same as this.
Oh, okay.
Yeah, but we have many people, well, instructors, people who are learning to be instructors. I teach them, and yes, and it's recorded, of course, so that they can watch it back, they can replay it.
Is there a Japanese instructor?
Yes, I'm sure there are. There are Japanese instructors. I can't remember their names though, but I'm not so sure for Japan, but definitely for Buteyko Clinic. We had 2 instructors, and yeah, one is Ken, and I think the other is Jan, but they're based in Japan. But you will see from our website, oxygenadvantage.com, and if you look for then the Japanese flag, you will be able to see. So I'm just going to check now, but definitely we have Buteyko instructors in Japan. And I'm just checking to see if we have But I think we have 2 instructors in Japan for Oxygen Advantage as well, now that I think of it. So for Asia, so I'm just checking now, it's taking a little while. Okay, the internet is quite slow here, so maybe it hasn't happened. Okay, it hasn't come in yet, but you will be able to check. If you look at our instructors, then you can check where they are and the different countries. Yeah.
Thank you. I have been to your website, so I think I can find it.
Yes, great. Great.
To your online course, not for trainers, but
for people to learn it for themselves. Yes. We have Oxygen Advantage online training, and we also have Buteyko Clinic online training for people who want to learn it themselves. So Buteyko Clinic, we have courses for 2 hours. Anxiety, courses for asthma, and course for sleep problems. And Oxygen Advantage for people who want to learn it for sports.
Yes.
It's 2 hours for sports. Different websites.
Okay. So we can choose with our programs.
Correct.
Thank you. How do they... I'm sorry.
It's okay.
Oh. How long does it take to improve their problems? I think it depends. But...
It depends. Somebody with asthma, we would expect them to have about 50% less symptoms in 2 weeks. It can be quick, yes, for people with asthma.
Wow.
Once they put the exercises into practice. For somebody with a stuffy nose, we can show them how to open up their nose in a few minutes. Now, of course, their nose gets stuffy, but the more they breathe through their nose, the better their nose works. So typically 2 to 3 weeks of practice, people will notice a difference with their sleep, and it can be a big difference with deeper sleep, better breathing, less coughing, less wheezing. For sports performance, we will be looking at 4 to 6 weeks. That when an athlete switches to nasal breathing during training, that when they do breath hold exercises, that we would expect a difference between 4 and 6 weeks to feel a difference.
Wow, that's so quick.
It is quick, yes. Yes.
Okay. Finally, I would like to ask your dream.
My dream is to live a fulfilling life. And like everybody, we are all here to achieve happiness. I would like to have a balance, and it would be for personal is to have a balance between free time, family life, and work life, to give more attention to myself, which we should do in terms of as opposed to work, but on a wider scale is to bring a stillness to people's minds. That people's minds can be very noisy and it can create a lot of unhappiness. And bringing the tools and, into one's way of life to bring a quietness to the mind. I think it's very important for each individual. And for me, it has made a tremendous difference. It's something that I practice all the time. But it would be amazing to see it become better known, that individuals had the capacity to achieve stillness and gaps between thoughts, to achieve a quieter mind, and to achieve happiness.
Thank you.
You are very welcome.
Okay. I think it will be almost an hour. So thank you for having me today again.
You sure? No problem.